Hello and welcome, Amanda.
It's
Uh,
lovely to be here. Nice to see you again.
It's great to see you. And how are you today?
Do you know, I'm really, really well, thank you. The sun has come out today, so that makes all the difference here in
But
the northeast
where?
of England. So
So where are you?
I am in the northeast of England in South Tyneside. It is a really beautiful part of the world. It's known for being quite industrial, but it's right by the seaside. And I love it. I just feel like it's my spiritual home. I feel really lucky to live and work here. My work's based in South Tyneside, but I have a clinical practice in North Yorkshire as well. I am a Yorkshire lass,
Okay.
born and bred Harrogate. That's posh Yorkshire for people from the UK. But I see people face to face in Harrogate and in South Tyneside, but I do mostly work online at the moment.
Okay.
Yeah,
Good. I
yeah,
guess that's,
love it. Yeah.
I think many people these days work online or conferences online. It has its advantages and
It's so
disadvantages.
much more accessible for people. They can just be in the comfort of their own home,
Right.
which is great, particularly if they're doing sort of the deeper work or they want that additional layer of confidentiality that working from home in their own space can bring. So yeah, it's great. I love it.
And also the fact that we can learn and teach online, so people can probably watch this right now in the conference from the comfort of their own bed or sofa or home. They don't
That's
have to
true.
travel anywhere.
I know it's
Fantastic.
great, isn't it? Well, alongside my clinical work, I do actually teach. I'm the founder and director of studies at the Northern College of Clinical Hypnotherapy. And in the old days, when I first started, it was all face-to-face learning, come at a weekend and learn for 2 days and then go home and practice a bit. And I just didn't see students doing as well. Working this way has been surprisingly because I didn't think it would. But I was really surprised at how the quality of their learning has improved, simply because they're at home, because they can fit it around their lifestyle. Yeah, it's amazing. So I've changed how I teach hypnotherapy and how I deliver hypnotherapy in my practice as well.
Fantastic.
It's been a transformational few years, but it gives me so much freedom in my life, and I love it.
So this transformational journey of hypnosis for you, well, where did it start? How did you come across hypnosis?
Do
Not
you
the
know,
whole story, okay? Just
I was working for the hospital. I was working in the NHS. I was working on the community. All my patients were quadriplegic and ventilated. So
hold on,
spinal
hold on.
injuries. Yeah.
Yeah, what does that mean? Sorry.
So quite a high break in the spine. And do you remember Christopher Reeve,
Yes,
Superman?
Superman, yes.
So, all like Superman, like paralyzed and dependent on a ventilator to
Okay.
breathe. Those were my patients. I worked in North Yorkshire on out in the Yorkshire Dales. I was on the community. A lot of my patients rode horses, had horsing injuries, swimming injuries, came off things, broke necks, and ended up in this situation. I was part of a team of nurses that took people home to live at home. They were going to be in this place for the rest of their life, so it was about getting quality of life back. But well, more than one, but one in particular, one client that I worked with frequently had what we call neurological pain. That was what it was called in them days. This is pain that cannot be understood because there's a break in the spine. You shouldn't have any sensation, but sensation that people have are quite often is quite often confused sensation. And for that client, they described it as being burnt with hot pokers, like somebody was burning them with hot pokers on their chest. I have never forgotten that description because I can't. Can you imagine being paralyzed from the neck down, having to have a machine that breathes for you,
Yeah, please
um,
don't.
and just being in pain all the time? It was just awful. And we tried all sorts of medications. Mostly the medications that we were prescribing or delivering were opiate based medications or synthetic opiate based medications. But there was one day when I went into work and he was having a really bad pain day, and I just said, "Oh, I'll get you some pain medication," and he just said, "Do you know what? When you give me that pain medication, it doesn't actually stop me from being in pain. It just it just makes me so out of it that I can't tell you I'm in pain anymore." I was like, no. Not only are you trapped in your own body and you're having a machine breathing for you, but now you're in pain and you can't even tell me anymore. We have to look at something different. So I started researching alternative medicine, discovered there was a Reiki healer who worked at Barclays Bank, discovered there was an NLP hypnotherapist that worked in the local area. We had reflexology and all sorts of people coming in to have a go to see if we could do anything to reduce the discomfort that this patient was having. The two things that worked, the first one was Reiki, and I was like, what is this witchcraft? Energy medicine. I had no idea what it was. This woman just laid her hands on someone and he just kind of went, oh, and I could see the pain just melting away. But it was like a temporary fix. It wasn't something that he could then use for himself. But the second thing that I saw work was hypnotherapy. And the therapist gave us an anchor on the top of his head that he could feel, that we could then activate, that released like a pain medicine that worked for him. I was like, this is amazing. And I was just totally hooked. Totally hooked. I went off and studied energy medicine, traditional Chinese medicine, fascinated by it. I ended up studying to be a counselor and doing psychology, and then trained as a clinical hypnotherapist and thought, this is it. This is the one that I love because it works quickly. It gives clients the tools that they can use to support their own healing. And I love that that is so empowering. Like the tools for healing are within you, and I'm just going to help you find them. Magic, magic, magic. So that was it. Hooked.
Amazing. And that was so you saw how amazing it is with pain. Yet these days you work a lot with addiction. Uh,
Yeah,
wait,
I
wait, wait,
do.
1 second. And the presentation that you're going to give is about the inside, the emotional engine of addiction. Now, that's a very intriguing name. I'm not going to ask you to explain it because you're going to do that in the presentation itself. Maybe in a few words, you can talk a little bit about what people can expect from the presentation.
Well, I am going to be looking at addiction from a slightly different perspective. I think for many of us, when we're working with people who are struggling with addictive patterns, addictive behaviors, using substances, they're when they walk into the office, we're all like, what substance are you using? How much are you using? How often are you using it? And it's all about the substance. But actually, what they're coming in the room with is they're presenting you with the challenges that they're experiencing in their lives. They're presenting you with their emotional internal states. They're telling you what they're struggling with, and it's very much to do with the emotions. It's very much to do with what they're imagining in their mind. And as hypnotherapists, that's our language. That's what we communicate with. That's the language of the subconscious. So when I start talking with the client about sensations, about emotions, about imagination, what's driving you all of a sudden I've got a whole new perspective that looks at addiction in a completely different way. There is a need for relief. And, Gabor Mate talks about how addiction is often an attempt to escape from pain. But I also want to address in this presentation how for most of the people I work with, they haven't had big, massive life traumas. They haven't had big, massive, they haven't got PTSD or CPTSD. They might have had a normal life that somebody's had, but they've probably been brought up in quite a nice lifestyle. But the addiction is helping them to feel calm. It's helping them to access confidence. It's giving them a sense of connection or belonging. It's helping them to feel comfortable in their own skin so that they can also experience love, and they can also experience joy, and they can also experience connection with others. What they're really doing is they're using some substances to help regulate their own nervous system. They're using substances to give them something. So, with the protocol that I'm going to be sharing about, it's a sensory, emotion, state based survival strategy where we're looking to meet those needs, those desires that are driven by the emotions, that are driven by the imagination, that are very often rooted in experiences, but in a way that deals with regulation before transformation. And then what we find is we're looking at helping that hijacked brain. We're looking at helping that person get from that restless, irritable, discontented, dopamine survival, the brain system being hijacked to a place where there's understanding, there's compassion, where there's regulation, and where we're actually looking at what are the needs that were being met by this substance. I have created a bit of an emotions map that connects to brain bits and connects to types of substances and how they work in the brain and what kind of emotions are stimulated as a result of that. But I'm a recovered drug addict and alcoholic myself. So a lot of this is from my own personal experience of having 10 years in recovery. At the end of March, I'll have been 10 years in recovery. Thank you very
It's
much.
amazing.
But hypnotherapy really helped me. I came out of rehab. I was sober, but I wasn't in recovery. I was clean and sober and healthier than I'd ever been for a long time, but I didn't know how to live. And I still needed these emotional states. I still didn't know how to let someone love me. I still didn't know how to have a sense of headspace and calm. I still didn't know myself well enough to have boundaries to meet my own needs. And that's what this protocol does. It helps people to
Wow.
find what their own needs are so that they can meet them.
Well, first of all, it sounds fascinating, and I think that the fact that you're going to share protocol, which you know that it works because it works for the people you work with, and you know the experience firsthand. I think that's
Yeah. I
amazing.
mean, I've been working in this field now for a number of years, and over the past year, I got to take this out of the therapy room and into the community where I was working with people who were homeless, rough sleeping, and I got the opportunity to work with 20 people that were rough sleepers and addicted to a variety of different substances, polyuse mostly, who were really poorly people, who had fallen through that net of that safety net and were now living in parks and sleeping rough. And I was able to take this work into that space, and I worked with them for about 9 months in total, some slightly longer, some a little shorter, and every single one of those people are now in a house.
Amazing.
Some of them have got jobs, not all of them, but they're in a house. They're all in recovery at varying stages, and they're all really amazing contributing members of society. There's some chefs, there's some
Mm.
carers, there's some musicians, there's so much talent and gorgeousness in those people, and it was so amazing to see how this works in some of the most challenging spaces, not just for those people who've still got a car and a house and a wife and a dog and
And it's very
stuff.
cool.
Yeah, yeah, yeah. Because a lot of people, who use substances, they've still got quite a nice life.
Yeah.
Um, but here in this country, drug misuse among just men is 14.2 per 100,000, which is double the national average rate. So where I live, there's a huge problem. And deaths as a result of alcohol are really higher here as well, as 62.4% per 100,000, compared with like 38.9% in the rest of the country. But I think the scale of the problem is huge. Hospital admissions because of alcohol, specific
Let's
conditions.
okay. I
The
have
ripple
to.
effect is
Yeah.
massive. Yeah, yeah. Tell me.
Like,
You can tell
let's
I'm
leave
passionate about this.
to the government to deal with because we are running a little bit long on this interview. So,
Yeah.
Amanda, I want to ask you two questions. Brief answers, okay? Don't go into the whole story.
Brief, I'll do my
Brief
best.
answers. Okay. Question number one. Do people that do not work with addicts, do you believe that they also have a lot to benefit from listening to your presentation?
There is nothing that I'm bringing that a qualified clinical hypnotherapist cannot do. They're everything that I'm bringing in this session is a combination of good old-fashioned basic
No,
hypnotherapy techniques.
what I mean is that for a person who doesn't work with addiction, a person who deals with other things, I'm pretty sure that you're still gonna bring into in your presentations ideas and life learning and
Oh,
experience that
sure.
can be
Yeah,
applied to
sure.
not just working with addictions, because I don't want people to think, oh, I'm not working with addiction. What can I get from this? Because I have a feeling that we all can get a lot, because I think I'm guessing here that working with people with addiction really bring out a compassionate part in in the therapist, and
For
that's
sure.
always important.
And I think when we look at when I look at addiction, I'm obviously looking at some of the darker sides of
Mm,
addiction. But most therapists are dealing with scrolling addiction, relationships addictions,
exactly. Yeah.
food addictions. We're all working with behavior change. We're all working with behavior modification. And I think to to have an approach that looks at regulation, that looks at empathy, that looks at being congruent, genuine, in the therapy room with people, that looks at a way of really bringing about acceptance of where they are in that moment and understanding that these are drives that are very much rooted in imagination and influenced by imagination and emotion. That information is going to help you in with whoever walks in your door, whether it be anxiety, whether it be can't sleep at night, or whether it be can't stop scrolling. These are all techniques that can be adapted. They're all techniques that you'll know, but can be adapted and used for a variety of clients for sure. Yeah.
Great. I promised two questions. So the second question, and that's an easy question, and it's a one word answer. From you see, from 1 to 10, how excited are you about that presentation?
Oh, 11.
Oh, okay. All right.
I think this is the most important work right now because there's so much need. And I want therapists to feel that feel confident and competent to do this work. I want them to feel motivated, inspired to do this work because there's a huge need.
Amanda, thank you so, so much. And I'm really, really grateful and honored that you're going to be with us on April 25th, 26th. It's the conference, and everyone is invited. And it's free registration, hypnotichorizon.com. And we'll be there. We hope to see you as well. And that's it for today.
Yeah,
Thank you
I'm so
so
looking forward
much.
to it. Thank you for interviewing me. I do love to talk, so well done for keeping me.
Well, you'll only have an hour for the presentation, so better work it. All right.
Got it nailed. Got it nailed.
Good. All right. Thank you so
Thanks so
much.
much.